Infection control, safety and prevention. The Infection Control, Safety and Prevention Training and Education course is designed to help healthcare providers learn and understand principles of infection control and risk assessments to guide appropriate infection practices and prevention. The course also identifies the chain of infection, standard and transmission-based precautions, barriers in the use of personal protective equipment, and strategies for preventing the spread of infectious disease to healthcare workers and clients. After completing this training, you will be able to define how pathogenic organisms may be spread in healthcare settings and factors that influence the outcome of an exposure, implement strategies for standard and transmission-based precautions in the healthcare settings, describe and apply practices for prevention of procedure device-related infections, and describe measures to prevent transmission of occupational bloodborne paths. A pathogen is a tiny living organism such as a bacterium or virus that makes people sick. Pathogens are the primary causes of the spread of infectious diseases. Infection with a pathogen does not necessarily lead to disease. Infection occurs when viruses, bacteria, or other microorganisms enter your body and begin to multiply. Disease occurs when the cells in your body are damaged as a result of infection and signs and symptoms of an illness appear. The incidence of disease among those infected varies greatly depending on the particular pathogen and individual's susceptibility. Pathogens include, but are not limited to, bacteria, viruses, fungi, and mold. Infectious diseases include, but are not limited to, cholera, diphtheria, the bubonic plague, pneumonia, tuberculosis, or others. Other well-known infectious diseases include hepatitis A, hepatitis B, human immunodeficiency virus, and acquired immunodeficiency virus. Hepatitis is a viral infection that affects the liver. Hepatitis A is usually caused by the ingestion of contaminated food or water. No medications or other treatments will cure hepatitis A. Most people who get sick with hepatitis A get over it and it does not become a chronic illness. The most significant difference between hepatitis B and hepatitis C is that people may get hepatitis B from the bodily fluids of an infected person. Hepatitis C usually only spreads through blood-to-blood contact. Hepatitis C has become a curable disease. Hepatitis B is manageable, not yet curable. HIV stands for human immunodeficiency virus. It is the virus that can lead to acquired immunodeficiency syndrome, AIDS, if not treated. HIV attacks the body's immune system, specifically the CD4 cells, which help the immune system fight off infections. It is treatable, yet there is no cure. Acquired immunodeficiency syndrome is a chronic, potentially life-threatening condition caused by HIV. By damaging your immune system, HIV interferes with the body's ability to fight the organisms that cause disease. There is treatment for AIDS, yet there is no cure for it. There are many factors that influence risk for infection. These include age, disease processes, lifestyle, medications, travel history, and more. Pathogens can live in multiple places in the body. A few places that are popular are lungs, blood, and the digestive tract. Infection control is identifying and reducing the risk of infections developing and spreading. An infection control program investigates, controls, and prevents infections in the facility, decides what procedures such as an isolation should be applied to the individual resident, and maintains a record of incidents and corrective actions applied to infections. There are three basic routes for transmissions: contact, droplet, and airborne. There are two types of contact, direct and indirect. Droplet typically is larger, they don't travel long distances, and are not infective over time. Airborne are smaller, infective over time and distance. A portal of entry can come from any opening of an infected person: nose, mouth, cut and skin, eyes, or anus. Standard precautions are the guidelines for preventing exposure to blood, bodily fluids, secretions, excretions, broken skin, or mucous membranes, based on the concept that bodily fluids from any person can be infectious. It should be used on every person served, and necessary personal protection equipment should be used. Pathogens travel from one person to the next through air, hands, and other surfaces. Hand hygiene has been identified frequently as the single most important practice to reduce the transmission of infectious agents in healthcare settings. Hand hygienes include washing hands with soap and water, use of alcohol-based products that do not require the use of alcohol, and not using artificial nails when having contact with high-risk persons. The guides to washing your hands. You should wash your hands first with clean, warm, running water. Apply the amount of product recommended by the manufacturer to hands. Rub hands together vigorously for at least 15 seconds, covering all surfaces of the hands and fingers. Rinse hands with water, dry with disposable paper towel, and turn off faucet with disposable paper towel. You should routinely use barriers such as gloves or goggles when anticipating contact with blood or bodily fluids. You should immediately wash hands and other surfaces after contacting blood and bodily fluids, carefully handling and disposing of sharp instruments during and after use. When the infection control program determines that a person served needs isolation to prevent the spread of infection, the facility must isolate the resident. The facility must prohibit employees with a communicable disease or infected skin lesions from direct contact with persons served or their food if direct contact can transmit the disease. The facility must require staff to wash their hands after each direct person served contact, for hand washing is indicated by acceptable professional practice. Other ways to stop infections include cleansing, disinfecting, sterilizing, no sharing, bagging of hazardous waste, and linen handling. Use standard precautions with everyone, wear gloves, handle used equipment with care, dispose of needles properly, wear face mask and eye protection when necessary. And remember, according to the Center for Disease Control and Prevention, clean hands save lives.